For the past 9 months, Ugandans have been living in a state of fear and anxiety as many have lost sources of income and loved ones to COVID-19 pandemic. A number of institutions and organizations have initiated several research projects related to COVID-19. Uganda National Council for Science and Technology has so far received over 120 COVID-19 related research proposals and only 99 have been approved.
So one key thing is to make sure that research which is conducted in the country is done in an ethical manner. And in relation to COVID-19, the key focus is to make sure that the safety of the patient is at the forefront.
COVID-19 related research is important in assessing the impact of the pandemic on different sectors of the economy.
We know that all over the world, the frontline health workers have been some of the people who have been affected most greatly. It is important that we protect our frontline health workers because there have been reports and have been cases, as we've heard in one of the studies over here, of a reluctance for health workers to step forward. And this differs to what happened in Ebola, where a lot of health workers volunteered. This is one of the reasons why organizations like this and the government are moving forward to getting as much protective gear, to training health workers on how to protect themselves and how to protect their patients.
One of the COVID-19 research projects was carried out by Makerere University School of Health Sciences and aimed at assessing health system support for psychosocial preparedness and needs of health workers. The research found out that 5 out of 10 health workers have stress and stigma, which is extended to the family members.
So what we really found actually high levels of psychological distress, anxiety, stress among healthcare workers. But again, also these problems varied from hospital to hospital because these hospitals are at various levels. They have different challenges, and therefore this could explain why, for example, the burden of these psychological problems differ from hospital to hospital. So, generally speaking, almost 5 in 10 of the healthcare workers present with symptoms of stress, depression, anxiety, and fear. But also what we found is that the demand for psychosocial support services is really very high because actually 5 in 10 of the healthcare workers have wanted to visit psychologists for counseling over this period of time.
The health workers are now advocating for continuous support and counseling aimed at preparing their minds as they continue to offer health care to COVID-19 patients.
Administration should be part. Be near them, talk to them. In fact, when you support them as a leader, they get more courage and they become more possible. And then always talk to them how they have to protect themselves. Every now and then, because when you only train once and then you forget and you leave people to keep on going there, because when someone goes there, if someone has never put on that coverall, you don't understand what it means. But if you have ever been in it, you understand. People come out when they are not almost like themselves. So they need support, a lot of psychological support.
We as nurses, we give psychosocial support. I don't think it's only the specialists who can do that. What is important, you need to talk to somebody.
Ugandan researchers are undertaking various projects to understand but also find solutions to COVID-19 pandemic. Adiana Kuti, UBC.